is Megan. I am a NCLEX prep and nursing school tutor. Today I'm going to be talking about some tips and tricks when studying for the NCLEX exam. I have been asked so many times as a tutor, Megan, how do I take the NCLEX exam? It's either they've either taken it before and have failed, or they are studying there and a lot of the information is not clicking. And that is all normal. The NCLEX exam does not make or break a nurse. I have known nurses that are brilliant, smarter than I am, and their clinical and critical judgment is on point, and they had to take the NCLEX exam 3 different times. It is a very complicated exam. It reminds me, like nursing school is this very grueling marathon, and the NCLEX exam is the last hurdle, and they always tend to make the last one more complicated, confusing, and difficult before you get to reach the goal of nursing. And they do that to just really try to weed out, in their mind they're trying to weed out who would and would not be a good nurse. However, it does not define you as a nurse at all. So some tips and tricks that I have written out here is, once you've gotten your time to test and from when you actually take the test, create yourself a study schedule. Do from this time to this time I'm going to be studying, and make yourself a goal of how many questions that you accomplish each day, but also remind yourself to take a break, breathe, do something that you actually enjoy, whether it's going outside, spending time with your family, going to a movie. Don't spend all 24/7 of your 24 hours of your day studying for this exam. You almost psych yourself out, and you overthink things, and you apply extra to the actual answers and questions, and then you find yourself where you're not getting the right answer consistently, and it gets frustrating, and you apply that to when you actually take the exam. So remember, create a study schedule, take breaks. My second trick is to don't necessarily do a full comprehensive review on everything. Now, if there are some subjects where you find yourself lacking, such as management of care, maternal and newborn, then do a comprehensive review of that area. But don't necessarily do a comprehensive review when you're doing, for the moment that you get the time to just learn everything that you learned in nursing school. It's too much information. You spent two years, maybe 4 years, learning this information. It's in there. It's in your head. You passed nursing school. You had to pass nursing school to take the NCLEX exam. So with that being said, I wouldn't necessarily do a full comprehensive review over everything. Just hit the areas where you feel like you are the weakest, and then, keep doing those practice questions. Read the rationales. Reword it in ways that you understand. Another trick that I have used is kind of teach it back to yourself. Teach, act like you're in a class and you're teaching it. Because a lot of times when you can teach it, the information. It's in there. You got it. The last thing that I have is called textbook nursing. Don't ever assume that from your experience from clinicals, or any healthcare experience that you have, applies to the NCLEX. The NCLEX is this perfect hospital with adequate staffing, unlimited time, unlimited supplies. And you don't add information that's not there, because you might think you might have 2 patients, and you might find yourself like, well, actually, I would put this as a priority because in clinicals, I found that these patients crash a lot faster or quicker. And remember, in the NCLEX world, it's perfect. Don't add extra to what's not there. I'm hoping that helps. Please message me if you're interested in any tutoring. I do NCLEX prep as well as nursing school classes, exams, or anything like that. I love to help. I love tutoring. As a travel nurse, kind of in between contracts, this is what I do. So please message me, and we'll get to know each other and talk more about it. Thank you.